Hello, my name is Marty Johnson from Total Health Nutrition Center, and I've been working in naturopathic medicine for the last 30 plus years, and seen a lot of different patterns with people. And today I want to talk to you about gallbladder issues. And I can talk to someone, briefly and go over symptoms. And because of the patterns that I've seen over so many years, I'd be a fool to not recognize that a lot of times people are dealing with gallbladder issues and just don't realize it. One of the main reasons why they don't realize it is because they've had tests and they've gone over with their doctor medically, maybe even specific gallbladder tests, and everything looks normal many times, and you can have multiple symptoms going on, so this can be quite frustrating. So I'd like to just talk to you a little bit about some of the symptoms that you could experience. Some you might recognize and some not at all. So with gallbladder issues, first of all, one of the major things that's taking place is that the bile that the liver is generating moves from the liver into the gallbladder, which is a little pouch, if you will, that's storing bile. When food moves from the stomach and into the duodenum, the beginning of the small intestine, it triggers it should trigger the gallbladder to squeeze some bile into that duodenum so you can break down your fats properly. But if a person has thick bile due to toxicity exposure over time, maybe eating foods that have more hydrogenated fats in them, things like that can start to thicken up the bile. Medically, we would call that biliary cholestasis or static bile. But many times, this type of issue doesn't show up on many of the tests that are performed. But what can happen is if that bile is not moving into the duodenum, you're not breaking down your fats properly, which can create a lot of problems. Number one being many times bloating after you eat, or unusual full feeling, maybe even a loss of appetite. Kind of the funny thing is it could go either way. It could be a loss of appetite or having a ravenous appetite because you're not breaking down fat, and you need fat to help your brain tell you that you're full. Your satiation type of trigger, if you will. So it can kind of go both ways. But the bloating is oftentimes, can take place. It doesn't necessarily have to be a lot of bloating to still have gallbladder inefficiencies. But one of the big things that a person could notice is where their digestion is not only off, but they could have heartburn or reflux because they're not breaking down fats, so you're getting more rancid fats coming up and creating the reflux or heartburn. The other areas that can be indicators, or symptoms that can be indicators, is a stiff neck. So right in the, both sides of the neck can get really stiff, where it almost hurts to, or it feels tight to turn your head. It can trigger headaches, especially in the temple area or across the frontal lobe, sometimes in the back occipital area all the way up to the front and behind the eyes. This is because there's specific meridians or acupuncture meridians that run through the liver and gallbladder that can be triggered and fire off these headaches and things of that nature. Other symptoms, you can even have discomfort from the neck down into the shoulders, where you can have just a lot of muscle tightness, and it doesn't resolve. Chiropractic massage might feel better for a little while, and it just doesn't resolve because it's actually coming from inefficiency in the gallbladder triggering those meridians. Right between the shoulder blades in the back, it can feel like a knot in there that just never seems to, you can't really get rid of it. You might get some relief with massage for a while, but it just keeps coming back. That can be a gallbladder trigger. And sometimes actually behind the knees, or overall muscle tension in the knee area, especially behind the knees, due to these meridians that can fire off. Another area that is oftentimes not talked about at all is the fact that if you are not breaking down fats properly, you're not transferring calcium from the blood to the tissues properly. So you need certain fatty acids to do that. And if you're not doing that, you can have more muscle cramping that just doesn't seem to resolve. or muscle tightness. You also need this calcium to transfer into the tissues for your immune system. Believe it or not, calcium is an important factor for the immune system and so forth. So there's a lot of different things that you wouldn't necessarily think of. The other trigger that oftentimes is not talked about is potentially waking up between 1 and 3 a.m. So your body works on a circadian rhythm, basically, and we want to make sure that if you have a gallbladder that's, a liver and gallbladder that's trying to clear out between that 1 and 3 a.m. process, that's usually when the body's trying to do that, it can wake you up and you can toss and turn and not sleep very well from that point on. So these are a lot of different potential triggers that oftentimes aren't talked about. We deal with these really on a regular basis in natural medicine. One of the things that you can do yourself is on the right side, right underneath your rib cage towards the right side, you can put your fingers under the rib cage and push in. They call that Murphy's sign. And if you push in pretty far and you feel like soreness in there or tightness or even pain, then you know that your gallbladder is somewhat inflamed or you have that bile that's thickening up and not moving out of there. It's not an absolute given. You can still have a lot of these symptoms and have gallbladder issues, and you may pass that Murphy sign test, but I'm just giving you that data as well. Oftentimes what we're doing in office is some out-of-the-box tests. I call it, we're looking at gray areas that medical tests don't look at to determine if there is inefficiencies. For instance, even the liver, you can have 40% inefficiency in the liver. It can look perfect on blood work. So those are the things that we do. We're looking in the areas that medically they're not always looking at. I hope this is helpful. And if you're looking to get help with some of these things, some of these symptoms or other areas that we work with, just give us a call at 262-251-2929. You can basically schedule a free or no charge consult, or like a 10-minute consult with one of our practitioners, just to go over your issues so that you can we can understand what you're dealing with. And this is no risk, no charge. If everything seems like it's a good fit, then we can always start scheduling an initial visit. Or you can go to our website at totalhealthinc.com and you can schedule one of those consults from there, and we'll be happy to work with you. Thank you very much.